Hi everyone, I'm Dr. Rana Sheikh and today we'll continue to speak about the dental amalgam. In this lecture, I will talk about the setting reaction and the amalgam properties. In low Cooper amalgam setting reaction, this type of amalgam is set by the reaction between silver tin, the original alloy particle, which known as gamma, with the mercury. Gamma, this is the strongest phase and the least corrosion. When they are triturated, silver tin from the original alloy particle dissolve in mercury, and mercury diffuses into the alloy particle, start react with the silver tin. Because the solubility of silver is much lower than that of tin, silver mercury precipitate first as gamma 1. Gamma 1, this is the second strongest phase and has intermediate corrosion resistance. Then tin mercury precipitate later as gamma 2, this is the weakest phase prone to corrosion. Here we can see crystal growth of gamma 1 and gamma 2. The original alloy particle do not react completely with the mercury. 27% of the original alloy particle remains unreacted. That's why the set amalgam, the hardening amalgam, contain unreacted silver tin, the original alloy particle, which is known as gamma, surrounding by matrix of gamma 1 and gamma 2. Gamma 2 penetrating the matrix of gamma 1 and make it weak. Also present epsilon phase. This is due to reaction between low Cooper and tin. In high Cooper amalgam, when admixed alloy and mercury triturated, silver from the eutectic alloy, silver Cooper, this is called eutectic alloy. So silver from the eutectic alloy enter mercury, and both silver tin from the original alloy particle enter mercury, and mercury start react with the silver tin like in low Cooper amalgam, forming gamma 1, gamma 2 and some unreacted particle of silver Cooper eutectic alloy and silver tin gamma. Later, most, if not all, gamma 2 react with the silver Cooper, forming eta phase. Adding high Cooper eliminate gamma 2 or reducing it to the minimum. Decrease corrosion and tarnish. Increase strength. Decrease grip. In general, is improve the amalgam properties. The set amalgam contain core of unreacted alloy particle of silver tin, which known as gamma, silver Cooper, the eutectic alloy surrounded by eta phase, and all embedded in matrix of gamma 1. Amalgam is brittle, have high compressive strength but low tensile strength. Amalgam gain its strength gradually. 8 hours after insertion, the restoration has approximately 80% of its final compressive strength. There is factor affect the strength of amalgam, like the time of trituration. Over trituration, under trituration, decrease strength. Mercury content, insufficient mercury, excess mercury, decrease strength. Insufficient mercury produce dry granules mix. The restoration will be rough, which prone to corrosion. Excess mercury decrease the strength also due to gamma 2. Other factors like the condensation or the pressure of the condensation, the presence of void, porosity, all can affect the amalgam strength. Micro leakage occur when there is gap or space between the restoration and the tooth structure. And in case of amalgam, it's occur when there is 2 to 20 micron wide gap between the amalgam and the tooth structure. Fortunately, amalgam is self-sealing material. due to the corrosion byproduct that form at the tooth restoration interface. These products, over a period of time, seal the interface and prevent leakage. But micro leakage can happen due to poor condensation, leak of corrosion byproduct, using of unicomposition spherical alloy, which show more leakage than lathe cut or admixed alloy, which has better proximal contact. A grip is the plastic deformation of amalgam under stress, and plastic deformation means it cannot back to its original shape, the opposite meaning of elastic deformation. Of course, using of high copper and low mercury content decrease grip. The trituration time and condensation pressure can change the grip rate of amalgam. Under trituration, over trituration increase the grip. Also, the delay between trituration and condensation can increase grip. Tarnish and corrosion. Tarnish is the surface discoloration, while corrosion is the actual removal material from the amalgam due to electrolytic or chemical action. The well polished amalgam, the smoother surface, can decrease corrosion and tarnish, and also using of high copper can lead to decrease corrosion and tarnish. There is factor lead to tarnish and corrosion like high residual mercury, presence crash and void, contact of dissimilar metals like gold and amalgam, patient on high sulfur diet like those who eat egg always, moisture contamination during condensation, and of course low copper is more susceptible to corrosion due to gamma 2 and other factors. Finally, I want to talk about amalgam blue, which is dark discoloration is happening in the tooth structure near the amalgam restoration. It looks like the secondary caries is caused by the gradual diffusion of the metallic ion from amalgam into the dentine. Other than aesthetic, it does not reason to replace it. And about amalgam tattoo, this discoloration that happening in mucose resulting from amalgam particle falling into small open wounds created during dental treatment. Also, amalgam is poor thermal isolator, that's why paste of either calcium hydroxide or zinc oxide eugenol is placed under must amalgam restoration to provide thermal protection. And there is a relationship between dental amalgam and oral lichen planus according to research published in 2004, in December 2004. I wish this lecture was useful. Thank you for watching and goodbye.